Hi, I'm Whitney Bryen. I'm the multimedia reporter here at Oklahoma Watch. And for the past year or so, I've been investigating COVID-19 in nursing homes and long term care facilities across the state. And today I wanted to show you one of the websites that I've been using to find documentation and records about those facilities. So I'm going to flip my screen around and walk you through a little bit of what's there on the state's website. Okay, so we've pulled up the website, which is surveys.health.ok.gov. One thing to look at here on the homepage that might be helpful is this About section. This is a good place to find the types of reports that are available. Now, one limitation of this website is that the only way you can pull up documents is by pulling them up by the specific facility. So you cannot search for documents over a period of time, in a geographic region, or by any other filters. So if I go up here to search, you'll see there are different types of facilities. For the purpose of our searches, I'm going to stick with nursing homes today, but each of these other categories functions the same way on the website. So if you're looking for assisted living centers, this will still help you. Okay, so now that we're on the nursing home search page, you'll see that there are 4 different ways to look up your facility. You can type in the name, the county, the city, or the zip code. Now, if you use one of the geographic locations, what you're going to get is a list of all of the facilities in that location. So Ada, for instance, we're going to search, and you'll find that there are 4 nursing homes in the city of Ada. The green is the highlighted name, and when you click on that, that's how you get access to these reports. So I'm going to go back one step, and I'm going to put in a facility name. Late last year, I spent some time talking with the owners of Beatles Nursing Home in Alva, Oklahoma. They had a COVID-19 outbreak, and I wrote a story about them. So let's search for them. And you're going to click on the name of the nursing home, and that's going to pull up all of the documentation. You have licensing information, survey documents. Those are going to be those annual inspections that are done to ensure that facilities are following procedure and protocol. You have certification information, more licensing and survey documents. And then I always sort this information by date. I want to see the newest documents first typically. Right now I'm seeing the oldest document first. So I'm going to click on this arrow here, and then it's going to put the newer documents here at the top. So you'll start to see here in 2020, you have a couple of documents labeled Other. It's pretty common for those documents to be COVID-19 infection control surveys, especially if they were dated in 2020. So let's click on one of these other documents. It's likely a COVID-19 survey. Let me bring this window in so you can see it. And yes, this looks like a COVID-19 survey. So you'll see on this page, it has the administrator's name, it has the date that the inspection was done, and it says here, no deficiencies were cited. If I click on page 2, it's going to specify here that this was a COVID-19 focused infection control survey, and the facility was found to be in compliance. So that means there were no deficiencies and they were doing everything under the guidance that was set for COVID-19. So let's close this window out. And let's take a look at another home. Let's go back to the search, and I'm going to click on nursing homes again. I'm going to look for the name of a nursing home that I know had some deficiencies from their COVID-19 inspection. It was Hillcrest Nursing Center in Moore. It looks like it's not pulling up the facility name, so I'm going to go ahead and look it up by location. Let's see if we can pull it up by searching for Moore. So this is a good example of the limitations of this website. The reason it's not recognizing the facility name is because the facility name has now changed. It's no longer called Hillcrest Nursing Center, and I know that because this 2120 address is the same address as the nursing home that I wrote about last summer. But now it's called Thunder Care and Rehabilitation. So there's no way that I could have pulled that up without knowing the new name of the facility. I simply found the address that matched and was able to pull up the facility that way. So I'm going to click on this and we'll see if we can find the original infection control document. I know that the survey was performed in May, so I'm going to look at this document titled Other because, again, those are typically COVID-19 infection control surveys. And this is the document that we were looking for. So you'll see Hillcrest Nursing Center is here in the subject line. So that's the name that the facility had back in May when they had a COVID outbreak and the infection control survey was performed by the health department. If you continue down this form letter, you'll see the survey results right here on page 2 where it says the facility was not in compliance. And if you keep clicking down this document, you'll eventually get to some information about what the Department of Health inspector found when they were in the facility. This talks a little bit about the immediate jeopardy of residents and staff in the facility, and there's tons of information in this document about what they were doing, what was reported to the health department, and what they saw when they were there on the ground. So this is really good information if you want to know how a facility was handling new COVID protocols. Okay, so I'm going to close out of this document and we're going to go back and we're going to do another search for a separate nursing home now. This facility is in Jones, Oklahoma, and I know this facility has had some abuse investigations in the past, which is why I wanted to show you some of these documents. So at first glance, it looks like there were 4 COVID inspections completed at this facility last year based on the other designation. I can also tell that one of these documents is 50 pages long instead of 3 pages long, which is standard for the COVID inspections. So that tells me that this is likely deficiencies from a COVID inspection. So if you're looking specifically for that type of information, it's pretty easy to spot once you know what you're looking for. In this case, I want to show you what a standard abuse investigation looks like. I'm going to click here on this February 2020 survey document because it is 325 pages long. That's a pretty good insinuation that there's a lot of information in this document and that it probably has a deficiency tied to it. So let me zoom out just a little bit so you can see this better. So as you can see, this looks kind of similar to the COVID-19 inspection forms. And you'll see here in the first paragraph, it says a complaint investigation was completed and the deficiency was found. If you keep scrolling through this document, you're going to find information about the actual complaint. You're going to find details about the deficiency. You'll see here, this is a page with some of the allegations listed here, and the S means those allegations were substantiated. US means they were unsubstantiated. And then as you go down, you can see allegation number 1 is more defined, number 2 as well, and then number 3 on the next page. So then you start to see exactly what the investigators found. It's laid out a lot more detail as you go through the document. So lots of information here in these survey documents that could help you decide which facility is right for you, which facility is right for your loved one, and also just checking in on how facilities are doing, if they're completing their plans of correction for any deficiencies that they might have had, or if maybe there's a pattern of deficiencies. So that's pretty much it. Hopefully that information was helpful. If you have additional questions, please let us know. Post comments on the video or reach out to us on our social media platforms at Oklahoma Watch, and we'd be happy to help you navigate some of these records.